so much of the time when a patient comes in the clinic, a patient, an athlete, whatever, first thing is we evaluate something, we get them on the table, and we just start working. And I think so many times people then will, the patient gets up off the table and you're done. And then it's, go about your day, and hopefully that's better. And for me, one of the challenges is doing what we need to do on the table, but then also getting up and incorporating that into, we just did all these things to free up different soft tissues that might have been limiting your mobility. And then we got things to activate to engage different muscles. Now, when we come in and we get into a running position or a single leg stance or throwing position, how does everything now get integrated and get reconnected to the system? And it's not just you get off the table and you leave the clinic, but we need to be able to build on that and show that now you have the mobility and you have the strength, but can you actually use it properly?
Yeah, from like a motor control place, I'm thinking, is that like, having somebody study for a test, just the, so the example, the picture I have in my head is, just getting the manual therapy, just quote unquote loosening stuff up, and then getting up and expecting your body just to, know it and use it. Is that, just like throwing a bunch of flashcards at yourself before a test and then being like, I got it.
Yeah, exactly. And I think one of the good things that I should probably mention in kind of framing our thought process is, so with the IPA, which we talked about, we basically have a treatment philosophy and 3 treatment pillars. And that's how I look at patients. And that is, no matter who you're treating, who you're talking about, we look at 3 main areas. Their mechanical capacity to move, do they have the mobility from joints, soft tissues, fascia, everything that needs to be able to move? Do they have the neuromuscular function to actually use the right muscles at the right time and have the right activation patterns? And that comes into a lot of our PNF. And then the third is motor control, is how do we put that together and actually use our bodies? And I think there's a lot of people that will only treat the mechanical and do tons of soft tissue work and joint work and not really then address the other 2. Or some will just strengthen and try to strengthen their way out of problems. And if you're not really getting the mobility and retraining the body how to use, you're really missing the boat. So I think you have to look at all 3 of those components when we're looking at an athlete, at a patient, at anyone.